Welcome to Heart Basics. In this segment, you'll learn how your heart works, common heart problems, and the risk factors that may play a role, who's on your cardiac care team, and what you and your loved ones can do to manage the emotions and dilemmas that may come with a diagnosis of heart disease. The human heart is a pear-shaped organ made of muscle. Although it's only the size of a man's fist, it's the strongest muscle in your body. Every minute or so, its strong pumping action can cycle all the blood in your body, making sure that oxygen and nutrients reach every part of your body. Blood flows into and out of your heart through blood vessels. There are two main types of blood vessels, arteries and veins. Arteries send oxygen-rich blood out of the heart to all areas of the body. The aorta, the largest and most important artery in the body, attaches directly to the heart and is like the main highway for blood leaving the heart. Veins move blood from the body back to the heart so it can be pumped to the lungs to pick up more oxygen. The heart has 4 chambers that keep oxygen-rich and oxygen-depleted blood from mixing. The upper chambers, the right atrium and the left atrium, receive blood from the lungs or the body. The lower chambers, the right ventricle and the left ventricle, pump blood out of the heart. 4 heart valves control the flow of blood through the heart. They act as one-way doors. They open to let blood flow through, then close to keep blood from flowing backward. On the right side of your heart is an area called the sinoatrial node, or SA node. The SA node controls the heart's pumping action by sending out electrical impulses. As the impulses travel down the heart muscle walls, they make the heart contract, squeeze. This rhythm, squeeze and relax, moves blood through the heart. When your heart pumps oxygen-rich blood to your body, the first muscle to get it is the heart itself. It receives this blood through the coronary arteries on the surface of your heart. Millions of Americans have heart disease, but it's important to remember that the term heart disease describes a wide range of problems, from heart valve problems to problems with your coronary arteries. Many people with heart disease have a combination of problems. As you learn from your cardiac care team about your specific heart problem, you'll also learn about your specific cardiac risk factors. Some common risk factors, like your age or your family history, are beyond your control. Others, like weight, smoking, and how well you manage your blood pressure or cholesterol, can be changed. Your cardiac care team will help you learn to manage your risk factors, and you can also watch the video segment titled Coronary Artery Disease and Risk Factors. Your cardiac care team includes all the people working in and outside the hospital to care for your health and well-being. The team will include doctors, your primary care doctor, and any specialists such as a surgeon, cardiologist, or anesthesiologist. It can include advanced practice clinicians, such as physician assistants and nurse practitioners. Nurses and nurse assistants will be a big part of your team, and so may other healthcare professionals, such as cardiac rehab therapists, respiratory therapists, dietitians, medical social workers, and others. The most important member of your cardiac care team, however, is you. You're a vital partner in your care from the very start. Tell us about your needs and what we can do to make you feel better. If we ask about your symptoms, side effects, or health history, please give complete answers. If you have a concern or problem, we want to know that too. Ask questions. Sometimes it helps to write them down as you think of them. Finally, follow through. Keep your appointments and follow your care plan once you go home. The goal of your heart care team is to help you heal. And a big part of healing is coping with the emotions that can come from your diagnosis and treatment. In your first days as a heart patient, you might feel like it's a little unreal. You might feel anxious, angry, or sad. These feelings are normal, and most of the time, they ease with time. What can you do to manage your emotions and keep moving forward? Here are a few tips. First, reach out. You may need encouragement, advice, or just someone to talk to. talk to your healthcare team. They can put you in touch with a counselor, volunteer, or religious guide who can support you and your family. Also, let us know if you have practical problems like getting around, getting in-home help like Meals on Wheels, or sorting out medical bills. We have case managers who can help. Emotional health usually improves along with physical health, so be patient with yourself. Talk to your doctor right away, though, if you start feeling you want to give up on life. This is a serious symptom of depression. Other symptoms include eating or sleeping too much or too little, or losing interest in things you used to enjoy. Depression is highly treatable, and you deserve a chance to feel better. If you're a friend or family member of a heart patient, know that you can help too. First of all, listen. Try not to offer advice. Ask if you can run errands, make phone calls, feed the cat, anything to lighten the load until your loved one feels better. And support healthy habits. Once your loved one goes home, you might help by organizing medication, adjusting the family's diet, or joining in on exercise. Finally, get support for yourself. You're under stress too. Take time to care for yourself and ask for support as you need it. This is the end of the Heart Basics segment, but there's a lot more you can learn. Please watch other video segments that apply to your situation.